Welcome back, ladies. We'll continue our conversation. So again, Emily, back to you. I thought it was interesting. I've heard that people younger and younger are getting diagnosed with colon cancer. Can you talk to us a little bit about that?
Sure. So the American Cancer Society released a study recently that showed that people born in the 90s were about 2 times more likely to develop colorectal cancer than people born in the middle of the last century. We don't really know why that is. There are some there's some suggestion that we've made some changes in our lifestyle and diet, physical activity levels that are contributing to that increase, but so far the evidence is inconclusive. They're continuing to look into that to find out what are some additional factors. That doesn't mean that we're changing our guidelines or our recommendations. So we still recommend starting at 50 unless you have a family history or other symptoms to get your screening starting at, because really your overall risk of developing colorectal cancer is still very low. So, the American Cancer Society and other organizations, including the United States Preventative Services Task Force, which issues those guidelines and recommendations nationwide, is still sticking with that. Let's get our screening starting at 50 and monitoring these trends very closely to see if we do need to change those guidelines in the future.
Great, good information. Thank you. So Amber, let's switch over to you and talk a little bit about the flu.
Sure.
So let's talk about the flu. What is the flu? And are there certain populations that should get a yearly flu shot?
Everybody over the age of 6 months should get an annual flu shot. That is incredibly important. So you asked about the differences between the cold and a flu. The flu can be quite a severe illness. It is way more severe than a cold. Even though a cold may have some upper respiratory symptoms, the flu is extremely contagious. It often is coupled with bone-chilling aches and pains. It can be spread extremely easily, especially to elderly family members that you may be in contact with. And in addition, there's usually high fevers and chills. So it is something that, millions of people get the flu every single year. And not every flu is preventable, but for those that are most at risk, which are the elderly and the young and those with chronic illnesses, it's really important to prevent as much flu as we possibly can. And the flu shot is your best shot at doing that.
Thank you. Well, so the symptoms are kind of similar between the cold and the flu. Is there a test to differentiate between the two?
There actually is. There is a nasal test that they can perform that can verify not only that you do have the flu, but also what type of flu it is.
Great, thank you. So if I do get a flu shot, is there a chance I can still get the flu?
Yes, there is. And there's lots of reasons behind that. First and foremost, once you receive a flu shot, it takes 2 weeks for the immunity in your system to build up. So if you were exposed to the flu prior to getting the flu shot, or within the 2 weeks before your immunity has built up, you simply got your flu shot too late. And so when people say that they got sick with the flu, even though they received a flu shot, you have to kind of look at those factors. The other issue that can happen is that there are several CDC experts that plan ahead of time and look at the most prevalent flu strains that are across the country. And so they develop a flu package. They started that as soon as the last flu season ended. And so you could have contracted a different strain of flu than what was actually in the vaccine. However, I do want to stress the point that if young and healthy people fail to get their flu shot and they do obtain the flu, they are so much more at risk of spreading that flu virus to those vulnerable populations that they're in contact with. Elderly, people that reside in nursing homes, your parents, your young children, all of those people really can't afford to get sick.
Thank you. So if I do get the flu, is there a way to treat that?
The best treatment is to stay home, rest in fluids, and perhaps some Tylenol.
Okay.
However, there is a class of drugs called an antiviral drug, and that can be prescribed by your provider. It only really works the best if you take it within the first 2 days of your flu illness. So many people haven't quite come to terms that they have the flu yet. So many times by the time a patient recognizes that they have the flu, it might be a little too late to be successful. The antivirals, in addition, they really only cut out 1 to 2 days of being ill. So it's not like you can take a miracle pill and feel better right away.
Yes.
So
Thank you.
they are available, but they are prescription only, and you need to go to your doctor and have a confirmed flu test before you receive an antiviral.
Great information. Emily, back to you. So the FluFIT program yet again, is there anyone that really should not participate in the FluFIT program?
Yeah, absolutely. So I will say that everyone should get the flu shot, as Amber said, but in terms of the FluFIT, if you have a history of colorectal cancer, you've had polyps before, you've had a family member who's been diagnosed before the age of 50, you're likely not a good candidate for the FluFIT program. People who have had a negative FIT test in the past year, or which means they didn't detect any blood in the stool, or they've had a normal colonoscopy within the past 10 years, wouldn't need to participate in the FluFIT. Okay. So either a FIT or FOBT that's negative in the past year, or a normal colonoscopy in the past 10 years. And that's pretty much the guidelines. But I do want to say that's for the FluFIT specifically. Do get your flu shot every year.
Thank you. So, healthcare professionals and doctors are busy trying to take care of business every single day, and it seems like maybe learning a new program for them might be time-consuming and a pretty big commitment. So what types of activities are underway to help make sure that doctors and other healthcare professionals that want to do this program are receiving the support that they need in order to deliver the FluFIT program?
You make a really great point. We are seeing more and more just, the amount of time that we have with our family physicians or our nurse practitioners is just getting shortened, and there's so much to cover in such a short period of time, and doctors and health professionals are asked to keep up with a lot of changing information. It seems like guidelines and recommendations are always changing, and they're not just dealing with cancer. They have so many other issues that they need to address in an office visit. What the American Cancer Society, Mountain Pacific, the state, Montana and Wyoming State Departments of Health, Primary Care Association here in Montana, and our insurance partners, Blue Cross, Pacific Source, are all doing is really working to support education for providers. So we've held a series of webinars that are across our Fort State region with Mountain Pacific to educate office staff and physicians and providers on the best way to conduct a FluFIT clinic in their setting. We're traveling this fall with some of our ACS experts to different clinics throughout Montana to educate providers in those settings on the FluFIT program and evidence-based colorectal cancer screening in general, so they have all of the information that they need to make the appropriate recommendation. So we're really doing everything we can to make sure that we're making those resources available and as easy to obtain as possible.
Great, thank you very much. So, in about 30 seconds or so, can each of you just drive home your take-home messages that you have brought to us today? That would be great. What take-home messages would you have to say?
I guess I would say get your flu shot, if not for yourself, but for your family.
Very good. Emily?
I would say, you can save your life if you get your screening from colon cancer. And you can also improve your chances of not developing colon cancer by eating well, exercising, and seeing your doctor on a regular basis.
That's such great information. I want to thank you ladies so very much for being with us today. It's valuable information. I learned a lot. There's a lot of things that I wasn't aware you were all doing, so I appreciate that. It's a topic that's near and dear to my heart, so thank you very, very much.
You're welcome.
Yes, thank you. So the bottom line, if you're 50 or older, get a flu shot and get screened for colorectal cancer. If your doctor isn't participating in the FluFIT program, ask about your options. Home tests are reliable and can detect potential problems. Also remember that you have a choice of which colorectal cancer screening test you receive. Yearly FIT tests are easy to do at home. Talk to your provider about flu and CRC screening. You're the driver of your care. Be an informed healthcare consumer. Until next week, stay fit, stay well, and stay healthy for life with Healthy Living for Life.
Healthy Living for Life is brought to you by Mountain Pacific Quality Health. We'd love to hear from you. If you have suggestions for future programs, visit our website at mpqhf.org or call us at 406-443-4020. You can also catch us on YouTube by visiting our website and clicking on the YouTube icon. Special thanks to Fire Tower Coffee House and Roasters. Production facilities provided by Video Express Productions.